Greg Hunt, welcome to Insiders.
Good morning, Fran.
Minister, will the government stop neglecting older Australians right now and announce more funding for these home care packages right now?
So we've taken immediate action. Indeed, straight after the Royal Commission briefing and the report being released, I went into the Council of Australian Government's Health Ministers meeting, and for the first time ever in Australian history, one of the elements of the Royal Commission was put into practice. The agreement was made to make the safe and quality use of medicines a national health priority. This comes from one of the three priorities that the Commission identified, and that was immediate action.
And I'm going to come to that now, but I want to talk about these home care waiting lists because they are shocking. I mean, 120,000 people waiting to get home care so they don't have to go into a home. 16,000 people last year died while they were on that waiting list. I mean, that is shameful. Why didn't the government have some announcement of some more money ready to roll out right now? Because this is not a surprise.
Well, we will be responding to the Commission. And
Why not now?
Well, firstly, Fran, because we only received the report at the same time as the public, a briefing an hour before.
Yes, but Minister, we all knew this problem. It's not an unknown problem.
With great respect, we are responding to what is the most profound and serious review of aged care in Australia, in the Commission's words, in 4 decades. We called this because we recognised that there were deep and serious challenges. The Commission went further than we expected in the sense that it identified a nationwide challenge over multiple decades. It identified both a cultural and a governmental challenge. And so we are responding. And there will be additional home care packages. There has already been, and I do think it's very important to say this, an increase, a doubling of home care packages, and including a 25% increase in the last year. So we've gone from 60 to 125,000 packages.
That's true, but it's a drop in the ocean. People are waiting on this on average. These are the top people needing top level of care, 22 months on average. So whatever you put in clearly isn't enough. Your own department told the Royal Commission it will cost $2.5 billion a year to get rid of that waiting list. So like I say, this is not news to the government. When the government does announce this funding package in MyEFO, will it be at least $2.5 billion?
It will be a significant package, so I won't preempt it. We will now consider and respond to the findings and the priorities of the Royal Commission, and we will do that. The Prime Minister said that because we believe in this, and I think it's very important.
Yeah, but how quickly? I mean, you know, the government has been doing things, but the point is the
first response was within hours. And,
well, we haven't got it.
And the reason, no, with great respect, the thing that we were able to do immediately, as we got the priorities, was to go into the Council of Australian Government's Health Ministers meeting and do what no government at any time has ever done, and to take this issue of chemical restraints, to make the question of the safe use of medicines a national priority, real-time response. Now we are working, as we have the 900 pages of the Commission's powerful and important and I think groundbreaking report, which deals with a culture within Australia, and we will be responding to that in the coming weeks. And I think that that's an extremely important message. Acceptance, acknowledgement, but for all of us, the message of this is that as a country, we have a challenge, and it calls that out, and I thank them.
It does call that out, but I don't think government
that.
should try and slide away from the fact that they are directly responsible for the policy responses. And I think it was surprising the government didn't have something ready to go.
Well, given that we are responding to the report, we responded, and here I respectfully disagree with you, in real time. With one of the elements, we were able to do that. The other elements,
let's talk about the other elements.
As we had the issues, we also signalled that we would be accepting and responding to the findings and the priorities of the Commission, and that's the right thing to do. In 6 or 7 weeks' time. No, I said within the matter of the coming weeks.
OK. The chemical restraints, the Commissioner says this needs immediate action to reduce the usage of it. In the words of the Commissioner, they render people drowsy, unresponsive and remove their ability to interact with other people. In other words, they sedate and stupefy residents. The government has some new regulations. They've gone some way to address it. But will this government now toughen those regulations to force a reduced use of these psychotropic drugs for management purposes? Or do we have to wait for Christmas for that too?
And we will be taking stronger action on those things. So I think,
what will we be doing?
Well, with great respect, let me finish the sentence. We will be taking stronger action, firstly, within hours of the report, we had the change in the status of medicine. Secondly, we are now working to make sure that we have the right response. But thirdly, we have already taken very significant action in terms of much tougher standards on chemical restraint and on physical restraint.
Yeah, with respect though, talking about chemical restraint, the changes you've made, as I'm told, do nothing to actually reduce the use of it, and it's pretty clear what is needed to affect that immediately. Just if I can say,
incorrect.
No clear informed consent before these drugs are administered should be put in place. There's no insistence at the moment on a behavioural plan before the drugs are handed out, and no register of how often they're used and why. And it's broadly agreed that those three changes, which the government could add to its regulation right now, would reduce the use of these drugs.
So let me talk about action and also the great national challenge here. In terms of action, we will be dealing with chemical restraint. A, we've taken steps already. B, in the immediate response to the Royal Commission, we acted within hours. And C, we'll take the further steps that the Commission talks about. And so we will be dealing with chemical restraint as one of the three priorities that they've identified for a response right now.
Do you think informed consent should be a part of that and a behavioural plan should be a part of that?
Well, our approach is to look at the elements outlined in the Royal Commission and to adopt them, and we think that that is an important and necessary step. The understanding and the role of families, the ability to make sure that we have checks and balances are critical. And this is the bigger picture. Why did we call this commission? Because we had deep concerns about
not just... Four Corners was about to launch a report that was going to reveal the degree of the cruel and harmful behaviour within.
This is a much bigger issue with respect. And I say that because what we've done on our watch, our time, and I do take that as a deep personal, profound responsibility, that if you're in these roles, you have to say, what are we going to change in our time? We called the Commission because we wanted a once-in-a-generation line in the sand where we said, what are the challenges? What the Commission found, which went beyond anything that I had expected, was a national cultural issue. And that's confronting for all of us, and indeed one of the headings in the Commission is confronting. And we have to deal with that as a country, but as a government, we have to take primary responsibility. It said it's been multiple governments over decades, the country as a whole, and indeed one of the saddest findings was the number of people who have no visitors. So on all of these things, what's the big change here? The big change is to deal with what the Commission refers to as an ageist society.
Well, I mean, you could argue...
and respect. And respect is both government and communal, and this is the moment, the line in the sand, together, where we change the way that Australians deal with ageing in what is, by definition, an ageing society.
All right, well, we wait for the government's response,
it will make us a better country and a better society as a result of the Commission.
All right, let's talk mental health. The Productivity Commission this week found as many as 1 million Australians are going untreated, slipping through the cracks of the mental health system. Many of them either too sick to be treated at the GP, but not sick enough to be admitted to acute care in hospital. This is a well-known and dangerous gap in care for people with mental health, as you know. What are you going to do about it?
So we're establishing a series of adult mental health centres around the country.
How many of them?
We are starting with 8 and we're building 100. Over the course of the next decade.
So that's a firm commitment? The government will build 100 of these centres?
I said that's our objective, and we're starting already. We have allocated over $60 million to that. Similarly, we have the eating disorder treatment centres, residential treatment centres being established for the first time in every state and territory. These are transformative, but the big picture here is, again, on Thursday and Friday, for the first time we were able to secure the support of the states and territories for a single integrated national mental health system, and that is a historic breakthrough and it's a landmark moment. The other thing which as a country we have to do is not just to provide the services, but we have to do that, but to give people that sense that to seek help is okay. That's one of the largest barriers is in some cases services, but above all else, the cultural moment of whether it's a farmer, whether it's a young person, whether it's an older person, crossing the line to seek that help. Self-stigma is identified as a great challenge, and we're saying to people, reach out, seek that help, and if you do that, then there are services that can assist and support.
It is an important message, but the next bit's crucial, isn't it? That when they do it, there are these services, and you talked about the structural reform you and the states agreed on, this unified mental health system. What does that actually mean? Because the Productivity Commission's preferred option in its report is regional commissioning authorities. It says that federal and state funds should pool their money, and these independent regional authorities should use the money to commission a range of services, basically, for people in the regions. Is that the model you support?
Well, actually, that's one of 88 recommendations.
It says it's the Commission's preferred option.
And there are two options there, and they've said that they'll come back. But
well, it does say it's its preferred option. I've got it here.
In fact, the big point here that the Commission wants is a unified system, and you ask, what does that mean? It means prevention, treatment and recovery. The prevention, where the Commonwealth takes the lead. The treatment, where in the early stages, again, it's the Commonwealth that takes the lead. But then as we build what is called by some, and I think appropriately, as the missing middle, this notion of matching what we do with Headspace for young people with the adult services, and then in the hospitals to have the capacity for people to have acute treatment, but then to be given support after they leave hospital. And that's been, in my judgment and in the Commission's judgment, a gap. And
so it's going to take more money, isn't it?
Look, there are always more investments and resources. We recently allocated over $700 million for the largest youth mental health and suicide prevention package.
Over how many years is that?
That's over the course of the budget period, but that's the largest package in Australian history on this front.
But the Alan Fels Commission, Mental Health Commission, when it talked about it, this was 5 years ago now, talked about it needing an injection of at least $1 billion over 5 years. I mean, there'll have to be extra money. Presumably you're not going to take it away from the hospital beds.
In every budget, we've added more since that time, so I think that's important to understand. Examples are recently $375 million for youth mental health, specifically through the work of Headspace. So a $700 million package, $375 million just for Headspace. But the big point here is building for younger people, people of middle age, people of older age, the support services. But within that million that hadn't sought treatment, the biggest barrier is actually self-stigma. And the difference is, stigma is where if I have a problem, you're not judging me. Self-stigma is where if I have a problem, I'm reluctant to go and get that help. And we know from evidence, research, that is still a huge issue in Australia. So if we can break that down, if we speak the language of common humanity, if we give people that sense of confidence, then they can access the services. At the same time, better work on prevention, work with the states on the support for people as they seek the treatment, but then the recovery pathways. Beyond Blue's program of tracing people and working with them in the way back is recovery after release from hospital that gives them support and is perhaps the single most powerful suicide prevention tool that this nation has ever had.
Yeah, no doubt about that, but we do need to make sure those services are there when they do get through the stigma, no doubt. On private health funds, they're under pressure. Premiums are about to rise again. They have to get your approval first. That's the law. If they come asking for a rise of more than 3%, will you sign off?
Well, we are being very tough with them. We've just produced the lowest change in 17 years 2 years ago, and the lowest change in 18 years last year.
But they're coming back again. It's still more than twice inflation. Will you sign off on something more than 3%?
Well, let's put it this way. We have reduced by 40% what the private health insurance premiums were under Labor. Now I'm pushing to go even further, and most significantly, we're doing this without what Labor was proposing, which was to rip away the private health insurance rebate from tens of thousands of Australians. Yeah, but
let's not worry about what Labor was saying. You're in power now.
Absolutely.
People are falling off at a great rate, young people pulling out of private health insurance. One health expert I've read described it as the industry as being in a death spiral.
That was somebody who wanted to abolish private health.
Well, it's also someone
Mark
very
Latham
well
identified that person and said that person wanted to destroy the Australian private health
expert.
I'd urge you to go to Mark Latham's book on that.
Is it time to set up a productivity commission review into the private health system?
No, we're actually getting on and doing it. We've already delivered the largest reform in over a decade in private health, which included better access to mental health, better access for young people, better access for rural and remote, and a dramatic simplification. What that did was lead to the lowest change in 18 years, but now we're going further and looking in particular at perverse incentives that have been in the system for decades, such as preventing people getting full treatment for mental health conditions, not just in the hospital, but through hospital in the home. And that again gives people better coverage, better chance of recovery, and that great human outcome of knowing that they can be cared for at home, which brings us back to exactly the sorts of things that we want to do in transforming aged care.
And more funding. Minister, thank you very much for joining us on Insiders.
Thanks, Fran.